We presented the data of the whole trial last year. What we saw is that drug-coated balloons are non-inferior to the drug-eluting stents in a situation where you treat small vessels, and we defined the small vessels as vessels of less than 3 millimeters in diameter. What we saw is that up to 1 year there was similar event rates for a combined clinical endpoint. We had cardiac mortality, non-fatal MI, and target lesion revascularization in there. And there we could show that there were similar event rates for both groups, and therefore we could establish the non-inferiority. This means it's a safe treatment for the small vessels. We did an angiographic subgroup analysis. This was something that we predefined in the protocol. We took all available angiographies that we had. At about 13% of our patients received clinically indicated angiography during the first year of follow-up. This means this was not a planned angiographic intervention. This was just what the centers gave us because patients had a clinical event. And we did this analysis to see what exactly happens in these vessels, whether there's more restenosis or a better late lumen loss or anything else. What we saw is that these two treatment groups, the drug-coated balloons and the drug-eluting stents, they behave similarly. We don't have any stent-like results in the drug-coated balloons, so the analysis showed that there are a little bit more restenosis. There's a little bit smaller vessels afterwards, but on the long run, we have exactly the same late lumen loss in both groups. And there was one striking finding. We saw a couple of patients with stent thrombosis, so acute vessel occlusion in 8 patients of the stent group, whereas there were no such cases in the drug-coated balloon group. So what we think is that we have a problem in stent patients, but we don't have any problem in drug-coated balloon patients. The conclusion I have is that you're safe when you treat small vessels of less than 3 millimeters in diameter with drug-coated balloons. So there's not a danger with that. In contrast, there's a danger if you put stents in there, because these stents could lead to acute stent thrombosis. And for clinical practice, it's just that we believe, or we think that drug-coated balloons are really a treatment alternative for drug-eluting stents in these kinds of vessels.